Medical Dilemma.
Welcome back to Medical Dilemma. Before we continue these discussions for our show today, I'd like to thank again our major sponsor, St. Clair's Medical Center, located at 1838 Dion Street, Palanan, Makati. Affordable, quality health care. And I also would like to invite our viewers to check out lifequestphilippines.com to check the seminars and webinars of LifeQuest Training and Consultancy Corporation. Now, going back to Father Jerry, we were talking about informed consent earlier. Okay, maybe it would be best if you describe, what are the elements of a complete informed consent?
As I have said previously, a consent or an informed consent must be a consent that is informed, which means that the information necessary must be there. It must be given to the patient, and if the patient is able to understand them, then that's the time that, well, he can give the consent, whether verbally or in written form. So what are these bases? First, tell the patient what ails him, which is the prognosis. Okay? This must be very clear to the patient. Second, what are the treatments that are available? There is no single treatment or single disease. There are many. Third, prognosis. What is the prospect? Is he going to improve? Will he have a quality of life afterwards? Or the risk of probably losing limbs or injuring himself or even death? And fourth, the affordability or the economic side. How much is he going to pay? Okay. These things was very clear to the patient. Otherwise, if there is one of them which have not been told or informed the patient, that consent is incomplete.
Okay.
Therefore, whatever consent he gives to, it may be invalid. But because these four are very important to the patient. The rest may not be very basic, but these four are very important.
Regarding the cost, I think that it's also the responsibility of the patient to ask the doctor. Because of the setup, the circumstances might be such that somebody might forget. But both the patient should ask and the doctor should answer. Truthfully, more or less, how much it's going to be. You cannot just say, so akong bahala sa'yo, don't worry, maliit lang yan. No, you have to tell and be frank.
That cannot be. These are very blurred. These are blurred answers.
So there has to be specific.
It has to be clear.
Figures.
Yeah. And even, for example, the affordability, how much a patient is going to pay or to be charged with. Because sometimes the patients, because he always believes in the doctor or the answer, oh, it's okay, it will not be much. But afterwards, it's too expensive. He cannot anymore pay. He has to sell his house, he has the land. And he goes, he goes back home, he has nothing more.
Now, Father, you mentioned that informed consent also involves discussing the options for treating a disease. Does that also mean that the patient has the right to choose among those options?
Yes, yes. With the aid of the doctor.
With the aid of the doctor.
Well, it also depends on the availability of this treatment in the hospital.
Yeah.
You need, for example, to have your kidneys don't remove with the most efficient and without opening up, but they don't have the ESWL, the electroshock wave lithotripsy. How can the patient choose? What is available also in the hospital?
Otherwise, Father, can the patient choose to transfer, or
of course,
or choose another doctor who can do it?
Yes, yes. That is what you call patient autonomy.
Patient autonomy.
Autonomy means autonomous, self-governing. You have to give that to the patient all the time.
So I think one of the basic elements of the informed consent is also that the consent is something that is freely given, voluntary.
Of course. Because a person
it can
cannot
be withdrawn anytime.
Right. A person to freely give the consent must have bases, and these are the bases. He must be able to understand this information.
May I ask, attorney, what if the patient changes her mind and decides not to go with it? to proceed, no? Pero schedule na sa hospital, yung doctor, tinabi
Is
niya yung
already
ibang
on
operations
board.
niya, already on board, no? Just for this patient. Is there any liability? Can the doctor sue the patient or what?
Well, that's a very good question. Kasi we always hear of patients suing doctors. But what if
Yeah.
it's the patient who's in breach of an
Yes.
agreement? I believe there can be a cause of action in that case. Pero kung hindi pa nasimulan yung operation, for example, the patient pulled out one day before, or if there's such a thing as giving notice, like opportune time to withdraw or back out from a certain agreement with the hospital and the doctor, then I think we can just return all the parties to their status quo before the supposed treatment. So
Maybe a simple apology, no?
Yes.
Explanation would be enough, right?
And
Right, but sometimes the hospital may be very strict. He has to pay all those expenses
That were
for
open,
the preparation,
yeah.
etc. Because the hospital also spends for those preparation.
for preparation, yes.
So,
Doctora, I'd like to cite another case. Supposing a patient is up for surgery, has given consent,
Okay.
and now is on the table.
Okay.
And then when the doctor opens up, doctor discovers we need additional procedures to be done. So
Okay.
what happens in that case?
It depends. If the patient is awake, because there are some anesthetic procedures, for example, where you do spinal or regional anesthesia, and the patient explicitly tells you, I want to be awake, I want to know what's happening. Sometimes they're watching on the monitor about what's happening. Then we can ask them.
Directly ask the patient.
Yes,
That
because
would be enough,
If it's
right?
if he's unconscious,
but if he or she is unconscious, then you have to look for the next of kin and ask for an extended informed consent. Like, this is what we found, and maybe you have to do this. Otherwise, we cannot close up the patient.
right.
What if the relative or next of kin is nowhere to be found? Sometimes they're in the canteen, everywhere, or they
Going
just left
shopping.
out. No naman. Huwag naman.
You know.
Maybe
But anyway.
maybe the hospital
It could be.
chapel, perhaps
You can treat her. Normally, we ask them to stay just outside the
Right.
perimeter of the operating room so that they're accessible in case of we have issues like this, no?
Well, as you
Perhaps-
know, if it is an emergency, something which is very urgent, you don't need.
the doctor can decide.
Yes.
Yes.
A doctor can decide.
Yes, and also if we have what we call an extended surgery. In other words, it is connected. For example, you opened up because there's a tumor in the ovary, and then you find that there is also something else. Now, if it is not an emergency, and you can wait, no, you can just, if you can't find the person to give consent, or even the patient cannot give consent because of the effect of the anesthesia, then you can wait for it, especially if it has to do with the reproductive system. You cannot just say, I remove also the fallopian tubes, so this patient can no longer have children. If it is not an emergency, then you have to wait. And if it is totally a different thing,
yes.
no, it's gallbladder surgery.
Yes.
Some,
Want to
no, we
remove
had
the
one
appendix.
doctor of gallbladder, tapos nakita niya appendix, ang ganda-ganda, inalis na rin. So, hindi naman nagalit ng pasyente because it's a plus na wala na yung appendix
Well,
niya. But
actually,
it's not really
That should be
should
included
not
in the
be.
informed consent. That,
Yes.
that in a case because we are going to open up
Yeah.
and then the appendix is just all there, can we already remove?
Remove it.
You have to ask for that consent.
Okay.
Okay. You have to ask. Unless it is very emergency that you cannot close it because there is something there that has to be done. Then, as the time that you can say, okay, let us just do it.
To bring the patient back to status quo,
Right.
right?
What if the decision-making capacity of a patient is questionable? So how do we get consent?
There's no
We-
next of kin, or you want the next of kin outside.
Well, actually, my
Yeah.
first question is, how do you know if the patient is competent to make or to give informed consent?
You usually ask the relative.
Not the patient, supposing under anesthesia.
Well,
Yeah,
Will
I'm
you
just
presume that the
imagining,
consent
You know,
is
let's
valid?
say under medication, so there
No, you have to ask
periods of,
somebody
you know,
else.
be lucid or
You have to ask somebody else to make the decision for the patient.
you have
Okay.
to ask
My
somebody.
assumption earlier was that the patient is totally awake and would like to stay awake. But if they're under the influence of an anesthesia,
Medication or anesthesia.
sedation, or any other forms of general anesthesia, then you have to ask somebody else.
Right.
Yes,
As a
Father.
matter of fact, part of that informed consent is knowledge of the guardian or whoever who should be giving the decision making while he was still awake. But when he is not anymore awake, incompetent, then you know already who is going to make the decision because it's already there. It's informed consent. The one who is going to make such a decision, okay? He should always be there around.
If assigned, right?
Yes.
If assigned.
Assign someone.
But if there's no one, legally, it's the
Yeah,
spouse.
precisely.
If there's a
There's
spouse.
no
no?
spouse, there's no one else. It's always the doctor, especially when it is emergency. There's no one else. You do not want to see your patient dead.
Just die. Oh,
Just
oh. Yeah.
I see. Now, in cases of patients that are of legal age, but the mind is not, equipped, maybe because of lack of education or lack of information, to make informed decisions about, treatments on himself or herself. How do we go about that?
And that is why they have to assign someone, knowing for a fact that the condition of the patient is such that he cannot make a good, complete decision. Yeah, you have already to assign someone else.
Who does it? The hospital or the family, the relatives?
Usually, the hospital or the doctor would ask someone who should be the one to make decision in case you cannot. In case you cannot. Well, usually here, kultura ng Pilipinas, the one who makes the decision is the one who holds the purse. We must always remember that.
But if the one
is
who holds
that,
the purse is abroad,
That's right. That's right.
you can have problems.
That's right.
That's complicated.
We have always to ask who should be the one to make decision. Okay, we have to ask. But if the one who holds the purse wants to make the decision, it's so hard to just
Ignore them.
ignore him or her.
Right.
Otherwise, the procedure will not proceed.
Or magkakautang sa hospital.
Magkakautang ka. Sige, ayaw niyo akong papag-decisionin. Okay, I'm out.
Yeah.
Okay.
So here in the Philippines, unlike in America, you have the insurance, etc., all the doctors.
HMOs.
Yes, MOs.
We have it
It
all.
should not be a problem.
Okay, well, I'm afraid we've run out of time for our show today. So maybe we can wrap up our discussions by giving your parting views, Attorney Sugitan.
Yeah, when it comes to giving informed consent, as what our doctors and Father Jerry pointed out, it has to be, it's a go signal, so it has to be very clear on many things, no, not just what the procedure is going to be, but on the consequences or the impact of that certain procedure.
Okay, Dr. Calimag.
Well, it's all about the trust relationship. We have to maintain the trust relationship, and our patients should know that we are doing everything to care for him with the best intentions.
Thank you so much, Dr. Father Jerry.
Well, when it comes to informed consent, it's all about respect for the free will of the patient. Respect for the free will is also respect for his dignity. And when we do all this procedure, it's actually to save and to protect the dignity of the patient.
Alright.
If this is always the basis of all doctors and everything, there will be less and less lawsuit against the doctors.
Okay, Dr. Sanchez.
Well, as for me, as I said earlier, the law is really paramount to everything else. If there is a law that says you have to report a disease, no, to the DOH or whatever, this must be followed. But as much as possible, we like to keep the confidentiality. But so only the persons who had the right to know should know.
Okay, thank you so much, Dr. Sanchez. From what has been talked about, we can say with certainty that the physician-patient relationship has become even more important as a foundation for successfully treating the patient. However, the circumstances of the relationship have changed, particularly in the need for shared decision-making and stricter confidentiality standards. Okay, thank you for joining us today on Medical Dilemma. Please watch us again next week. Help patients and families in crisis. Be aware and show you care. Okay? Have an enlightened week ahead of you. Thank you so much to everybody.
Wag mo na tataya kasi.
Medical Dilemma.